Great. So, Assalamu alaikum, good afternoon, good morning, or good evening, wherever you are joining us from different parts of the world. I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health and an Associate Professor of Clinical Population Health Sciences here at Weill Cornell Medicine in Qatar. So thank you for joining us today, and Ramadan Kareem to all of you. We are 10 days down already for Ramadan, and I hope whoever is fasting, it's going well for you. Just as a reminder, the overall goal of this Health and You Community Wellness Series is to really create community awareness about health and disease. And we really would like to see, that you are then able to enhance self-care, reduce suffering, and improve your quality of life, ultimately leading to increased healthy longevity. So as a reminder, your cameras and microphones, they've been turned off. You can use the Q&A feature to type questions or comments. You can also actually just type in questions, in the window chat, in the chat window, and we would be able to see them. And we will address the questions at the end of the session. And as a reminder, this is not a CME CPD activity, so no certificates of attendance will be issued. So we have a wonderful speaker today, and really, really an exciting topic. I think there's a large amount of interest in the topic. So it gives me great pleasure to introduce our speaker for today, Dr. Tariq Chukir. He's an assistant professor of medicine here at Weill Cornell Medicine in Qatar. He's also an endocrinologist at Hamad Medical Corporation and at Sidra. He's a clinician educator. He currently serves as the co-director of the internal medicine and the anesthesia and critical care clerkships at Weill Cornell Medicine in Qatar. He is also chair of the WCM-Q Grand Rounds Committee and the course director of the WCM-Q Obesity Symposium. Dr. Chukir's research interests include obesity and disorders of bone and calcium metabolism. He has published several book chapters and research papers in peer-reviewed journals and has contributed to the development of several national clinical guidelines in Qatar. Dr. Tariq Chukir, a very, very warm welcome to you. We are all looking forward to the session, and over to you.
Thank you so much, Dr. Sohaila, for the introduction. Thank you, everyone, for joining. Ramadan Kareem. Let me share my screen. Perfect. Can everyone see my slides?
Yes.
Perfect. All right. I'm delighted to be here to talk about a topic that I take care of all the time. It's a condition that's highly prevalent, and it's a topic that people talk about all the time. The title for this talk is Obesity, Separating Myth from Facts. I have no conflict of interest to disclose. What I plan to cover today is to clarify some misconceptions about obesity and about a disease that's very closely linked to obesity, which is type 2 diabetes. I will also discuss strategies to effectively manage obesity, which is the main driver of type 2 diabetes. And since we are in Ramadan, I will discuss special considerations during this month. As many of you know, obesity and type 2 diabetes are very closely linked. As the prevalence of obesity is increasing, it's associated with an increasing prevalence of type 2 diabetes. This is something we see worldwide, and Qatar is not an exception. Qatar has one of the highest rates of obesity and type 2 diabetes in the world. Historically, we thought about fat cells as passive cells, cells that are used to store fat, but they're not active. Our understanding of fat cells have changed. Now we know that fat cells do not only store fat, but they also play an active role in our body by secreting adipokines, hormones that play a role. These adipokines may contribute to insulin resistance, which is a main contributor of type 2 diabetes. Many people ask about the link between obesity and type 2 diabetes and what is it explained by? It's explained by the active role of fat cells in the pathogenesis of type 2 diabetes. And we've known for many years that weight reduction is associated with significant improvement in sugar control and other diabetes metrics. This is data from Qatar, published by Dr. Laith Abu Raddad here from Weill Cornell, showing the prevalence of obesity in Qatar and how it is projected to increase over the next several years. It's very hard, it's very prevalent in the Qatari nationals specifically, but it's high overall in all populations living in Qatar. I know it's over Zoom, but we'll try to make the session as interactive as possible. I have some polls questions. If you can scan this QR code to be able to participate in the poll questions that I will be sharing shortly. So after you scan, it will take you to a link. Skip for now. You do not have to register. So once you skip, it should take us to the first question. I'll give everyone a few seconds before I move into the next slide. Let's move in. The first question is what causes obesity? And I'm seeing some answers. Sedentary lifestyle, genetics. Many people thought genetics play a role. Environmental factors, lifestyle, sugar, multifactorial, which I agree with all these, diet, junk, junk food. Perfect. Mood disorders, depression, that's amazing. And I think we covered everything here. Perfect. I agree with all of you. So the obesity is a multifactorial complex disease. Many people who have obesity have a genetic predisposition, but genetics alone are not enough. Usually the manifestation of the disease is because of an interaction between genes and other factors. And as many of you mentioned, there are several other factors that contribute to the development of obesity. Unfortunately, we live in an obesogenic society. The time that we live in does not support weight loss. If we think about each one of us and how our lifestyle is, many of us are busy and have many other challenges that prevent us from engaging in physical activity. Most of us are involved in jobs that do not require a lot of physical activities. Studies shows that occupational energy expenditure, which is how much energy you use at work, has decreased over the years with the development that we see. Processed and calorie-dense food is easily accessible and affordable. Healthier food is harder to find, and when it's found, it's more expensive. It also takes time to prepare. And there is strong marketing for ultra-processed food, which makes it appealing for people to consume. And there is a big social factor. Many of us eat because we're not hungry. So hunger plays a role, but many of us eat when they're not hungry, and society plays a role. Many of our social activities are centered around food, which makes it harder for people to control weight. There are other factors. Many conditions are treated with medications, and some medications have been associated with weight gains, such as corticosteroids, for example. So this is important to keep in mind. So we do understand several factors that contribute to the manifestation of obesity, but there are many factors that we do not understand. We understand some factors that contribute to appetite and hunger control, but there are some factors that we still do not understand, and hopefully in the future we'll have a better understanding. Why is it important to recognize that obesity is a complex condition? Many people simplify that obesity is calories in, calories out. It's more complicated than this, and it's important to realize that there are many factors involved in the manifestation of obesity. Because Stigma stems from the misconception that obesity is solely a result of poor willpower. There's bias associated with obesity everywhere in healthcare, education, workplaces, and even at home from loved ones. And this leads to social isolation, lower self-esteem, and avoidance of medical care. There are studies that show people who experience discrimination because of their weight, they're unlikely to seek medical attention and have worse health outcomes compared to people who do not experience this. So that's why we should be mindful in our interaction with everyone in our society. Here is my second poll. If you go to the same page, it should automatically load. It's loading right now. Perfect. So let's see what you think about this. Eating food rich in sugar will cause diabetes. Okay, so we see that the majority agree with the statement that eating food rich in sugar will cause diabetes, and some do not agree. So let's delve deeper into this. It's important to distinguish between healthier, natural sources of sugar compared to processed sources of sugar. Sugar is present even in healthy foods, such as fruit. The reason I wanted to talk about this, because it comes up very frequently in my clinic, that people would avoid fruit to prevent the onset of diabetes because they have a strong family history of diabetes and they want to avoid diabetes, so they would avoid fruit. To answer this question, it's important to understand how sugar is regulated normally in our body. What, so the process in normal individual is the following. You eat food. In our GI system, it gets digested, absorbed. Pancreas will sense the food that's being absorbed and will secrete insulin that's enough to take up the glucose by tissues and achieve normal glucose in blood. This is in a normal, healthy individual. In people who have abnormalities in their sugar management, they will eat the food, food will be digested and absorbed, insulin will be released, but because of insulin resistance, the insulin that's released will be inadequate for the tissues to take up the glucose, which will lead to hyperglycemia. So the point here is that in people with normal bodies, if they eat sugar, if they eat carbs, their body will be able to manage it and maintain normal glucose. It will not cause diabetes. Diabetes, which is a term we use to refer to a status of high blood glucose, happens in people who are predisposed, who have the condition. When they consume too much sugar, when they consume too much carbs, their sugar goes high. So consuming food from natural sources rich in carbs and sugar, such as fruit, in moderation, will not cause diabetes. I'm sure the poll made you refer to processed sugary stuff, but here I want to make the distinction between sugar present in natural sources versus sugar versus added sugar, which is added to make the food tastier and sweeter. I just wanted to go over diabetes quickly to make sure that we're all on the same page. When we say someone has diabetes, we mean that this person has a condition that's associated with high blood glucose higher than a certain level. For example, the fasting sugar will be equal or greater to 126 milligram per deciliter, or the hemoglobin A1C, which is the cumulative sugar over 3 months, would be 6.5% or greater. And there is another test which we call the oral glucose tolerance test. We give people glucose and then we measure it in their blood. If the sugar is high in their blood, then we diagnose people with diabetes. Diabetes is divided into different types. The main ones are type 1 and type 2, and they're completely different. Type 1 is an autoimmune condition. Your body your immune system will make antibodies that will attack the pancreas, which secrete insulin. Patients with type 1 diabetes do not have the ability to secrete insulin. They're typically younger individuals and they are typically lean. Type 2 diabetes are patients with high sugar, but the cause is not insulin deficiency most of the time. The cause is insulin resistance. Their body is resistant to insulin. Their body is secreting insulin, but the tissues, the muscles, the liver, the fat are resistant to insulin. So the body is not able to take up all the glucose. And this is more prevalent and more associated with obesity. And there's a third type, which is gestational diabetes, which we see during pregnancy, has similar features to type 2 diabetes. Why am I telling you this? Our talk is about obesity mainly, but the reason I'm telling you about it because in Qatar, the main driver for type 2 diabetes is obesity. People who have obesity, people living with obesity are at 4.5 folds higher risk of developing diabetes compared to those who do not have obesity. Therefore, addressing obesity is important to prevent type 2 diabetes. Now that we've talked about the prevalence of obesity, we've talked about type 2 diabetes and some misconceptions associated with obesity and type 2 diabetes, let's move on to talk about obesity prevention and treatment. Obesity prevention is easier than treatment. Obesity treatment is not easy, and many people struggle during their obesity management process. So in the first few slides, I'm going to focus on obesity prevention, which is the way to go. I don't think treatment will get us will help us achieve a significant reduction in obesity prevalence, but preventing obesity will make a difference. And obesity prevention starts very early on. It starts when the fetus is in the mother's uterus, in the womb. During pregnancy, changes that happens during pregnancy are very important for the future of the fetus. For example, women who develop gestational diabetes, who have obesity during pregnancy, are more likely to have a child with obesity and type 2 diabetes in the future. So focusing on healthier pregnancy early on is very important. For example, let's say we're seeing a woman of childbearing age who has obesity and risk factors for type 2 diabetes. It's very important to counsel with her obstetrician and primary care physician before pregnancy and have a planned pregnancy when her health is optimized. Losing weight, if indicated prior to pregnancy, will help achieve healthier pregnancy outcomes. And this is one of the reasons why many patients are referred to us in clinic to optimize their weight and their diabetes before pregnancy or before IVF in some cases. It's unfortunate to see that many families are moving away from breastfeeding. Breastfeeding is associated with several health benefits, and one of these health benefits is a reduction in the risk of obesity. Infants who are not breastfed are more likely to have obesity compared to infants who are breastfed. And there are many other health benefits of breastfeeding. It's also important to keep in mind that the early life is very important because this is when people learn eating behaviors and eating habits. Many people do not have a structured lifestyle. And when you do not have a structured lifestyle, it's a risk factor to develop obesity. Emphasizing the importance and teaching habits and behavior early on that are focused on healthy lifestyle, healthy eating habits are very important to prevent obesity. It's very important to be careful with kids. So when you are educating kids, when you're counseling kids, it's very important not to focus on weight as the topic of discussion because it may lead to eating disorder. The focus should be on healthy lifestyle without a focus on weight per se. We're doing better, but we're still not doing as much as we should with regard to education from early on in school to college to after college. So I really think that we should do a better job educating the public about healthier lifestyle. We've had some policy changes that led to healthier food in school, which is great, but I think there's still a way to go with regard to education about healthy lifestyle to the public. And it's important to realize the importance of social interactions. As I mentioned earlier, everything in our social interaction is centered around food. And most of the time, it's food that's high in sugar and high in fat. So it's very important to modify our social interactions to involve physical activity, to involve eating healthier habits, and instead of just sitting and focusing on food. One of the changes that I really like that happened in Qatar recently is paddle. Paddle is a sport that became very popular and it drove many individuals to participate in physical activity when they were not doing that before that. So we need more of such interventions that will push people to involve in physical activity and healthier lifestyle. Obesity prevention is centered about healthy lifestyle. And when we talk about healthy lifestyle, there are several components. The three or the four main ones are dietary patterns, physical activity, sleep, and mood. Mental health is very important, closely linked to obesity. If someone is struggling, it's very important to receive the care they need so that they can have a better control of their lifestyle. Sleep is also very important. There are several studies linking sleep deprivation and reduced sleep quality with a higher incidence of obesity. People who do not sleep well have lower energy expenditure. They burn less calories. And people who sleep less tend to eat more when they're awake at night and tend to crave calorie dense and sugary food more. And I wanted to focus on structure because unfortunately, one of the major issues that we face in 2025 is that people live an unstructured lifestyle. And when your lifestyle is unstructured, it's very easy to consume more calories than your body needs. It's very easy to not perform enough physical activity as you should. And it's very easy to mess up your sleep schedule. Let's do the third poll and ask the attendees what they think the best diet for obesity management is. It should load in a second, so now it's loading. What do you think the best diet is for weight management? So calorie deficits, I saw it in the chat, but let's put it in the poll if you don't mind. I'll see if I can make this bigger. Perfect. Low carb diet. I'm not sure what Planet Diet is. Stop sugar. Low bread. Whole food, plant-based. Carb controlled. One of the attendees shared with us that they lost 30 kilograms with calorie deficit, counting calories and cardio. High fibers. So I'm hearing different things. So what I'm hearing here, many people are saying low carb, low sugar, low bread. Some of them are saying high protein. There's some mention of keto, which is a very low calorie, very low carb diet that's high in fat and protein. So let's see what the evidence say. So healthy diet is something that we recommend to everyone, whether you have obesity or you don't have obesity, whether you have diabetes or you don't have diabetes. So healthy dietary pattern is a recommendation for everyone. The only difference for someone with obesity is that we will tailor a dietary program with calorie restriction to boost weight reduction. Okay. What is considered healthy diet? There are many healthy dietary patterns, many. So there's no single one that's better than the other. What's really important is that when you're planning your diet, to take into consideration what you like, what your background is, what cuisine you like, and then you can focus on healthier sources. So what's important for healthy food is to get your food from natural sources as much as you can. Try to reduce significantly the amount of ultra processed food. When you're using grains, bread, rice, try to focus on whole grain, which contain more fibers. Unfortunately, most people do not meet the requirements with regard to fruit and vegetables. So we should definitely try to meet the recommendations with regard to fruit and vegetables around like 5 serving per day. Legumes are very healthy. Chickpeas, hummus, ful, fava beans. These are very healthy sources of carbs, and they have rich amount of protein. When we're consuming protein, whether meat, chicken, fish, we should focus on lean meat that's low in fat, and we should focus on healthier sources. Try to avoid processed meats as much as possible, and try to avoid and reduce the amount of food that is rich in added sugar and saturated fat. Saturated fat is fat that is solid at room temperature, like butter, ghee. So we should restrict the amount of this to less than 10% of the diet. The thing that we face in 2025, with easy access to processed sweets, with easy access to eating out and ordering food out, we are over consuming saturated fat. This is the main issue. So our diet in 2025 is unfortunately oversaturated with saturated fat and added sugar because of eating out frequently and because of consuming ultra processed products. With regard to weight management, it doesn't matter what type of diet you follow. What really matters is you adhere to the diet and it's calorie restricted. If low carb diet is a diet that works with you and works with your health conditions, go for it. If Mediterranean diet is a diet that you like and you can adhere to, go for it. So I'm not a big fan of keto, and the reason is many people are not able to adhere to keto long term, and in a few proportion of people, adhering to keto will increase the lipids and cholesterol. What I care about when I think about diet, what I care about is long-term adherence. And the reason I care about this, because this is what matters. This is an old study, but the results still apply. This was published in 2005. And what they looked at, dietary adherence. So what we see, the higher the dietary adherence to a certain diet, the lower or the greater the weight reduction, regardless of the type of diet that you follow. So what matters is, or the best diet for weight management is the diet that you can adhere to, the diet that you can live on. Many people ask about the role of intermittent fasting for weight reduction. Intermittent fasting is very popular. Many people follow it and enjoy it. For others, it does not work. So let me tell you what studies show about its efficacy. This is a good study. It's published in a journal that has a good reputation. It's a well-designed study. In this study, they compared conventional dieting with intermittent fasting with calorie restriction. Both groups achieved 500 calories restriction per day. And what they found is that both conventional dieting and time-restricted eating, intermittent fasting in this case so in this group, people were eating for 8 hours and fasting for the rest of the day. So both groups achieved around between 8 to 10 kilogram weight reduction. Most of the weight reduction was achieved in the first 3 months. And after that, there was a weight plateau for 12 months. So both interventions are valid for weight reduction. They're both efficacious. What really matters is whether this is something you can adhere to or not. There are different forms of intermittent fasting. There's 5+2, and there's time restricted eating. In this study, what they studied is time restricted eating, which is fasting for like 16 hours and eating for an 8 hour window. We talked about diet in general, about what's considered healthy food, what is the best diet for weight management, and we talked about intermittent fasting. Let's move on to talk about physical activity. Most of the weight is lost uh, by caloric restriction. If you add physical activity to caloric restriction, the weight loss will be augmented. Physical activity is extremely important for weight maintenance. After you lose the weight, if you ask people who maintained weight for a long time, what's the factor that contributed to their weight maintenance? Physical activity and exercise will be high up. Most guidelines recommend 150 minutes per week of moderate intensity exercises, and some guidelines recommend 300 minutes per week of moderate intensity exercise to maintain the weight. The the issue and the reality is that many people are not reaching this goal. Probably 30%. There are studies that surveyed the public, and less than 30% of the public are adherent to this number, to this amount of exercise. And people I see in clinic, frequently I tell them to pull out their phones, show me their health app, and you'll be surprised that some people are taking 1,000, 1,500, 2,000 steps per day on average, which is very low. Before I get to 150 minutes per week, I usually start with increasing their daily activities and gradually try to build up their exercise and physical activity program. Ideally, my goal is to reach a point where the individual is able to do a combination of aerobic and resistance training. Let's say they exercise 5 days a week, to have them do at least 2 days of the 5 days per week of resistance training to help preserve muscle, particularly during weight loss. We would like the weight loss to be primarily from fat. Resistance training is one of the factors that will help us preserve more lean mass. When people lose weight, they typically lose 20 to 30% from their lean body mass. Adding resistance training, meeting their protein intake will help them lose less lean mass compared to people who do not engage in resistance training and individuals who do not consume enough protein intake. So as I mentioned earlier, probably less than 30% of people meet the physical activity guidelines. There are different reasons why. In your opinion, what are the barriers that people face when it comes to physical activity? It should be loading soon. So here I see motivation, priority, adherence, coach, time and family, tiredness, knowledge, job, weather. Good. And these are very common reasons. So what I hear most of the time in practice is time is a big issue. People are at work during the day, and then when they leave work, they have limited time to spend with the family, help with their kids' homework, do other things. So time is a big barrier. Mm, Motivation is something that comes up, but many people are motivated. They want to make a change, but they struggle. Fatigue is multifactorial. So fatigue is something that we see all the time. It's very important to investigate why they're fatigued. Many people who are tired, who fatigued, may have a medical condition contributing to their fatigue. It could be anemia. It could be obstructive sleep apnea. It could be depression. So there are many things that can lead to fatigue. Investigating for other causes and treating them can help. And for many people who are fatigued, I tell them, in my experience, people who engage in physical activity feel better. The start is always hard, but once you start, things get better with time. This is a resource that I received from a health fitness. Uh, for those who tell me that we do not have time to go to the gym and exercise, which is time consuming. And for all of us, no one has time uh, throughout the year. But what's very important is to always have a backup plan. So if you don't have time, what can you do for 15, 20, 30 minutes at your home, either early in the day, midday, end of the day, just to stay physically active, to get your muscles moving? You can scan this QR code. It will take you to the video, and it shows some basic exercises that can help people start with. And hopefully, when they have more time, they can intensify the level of physical activity they do. But in my opinion, even when people are busy, they should at least find 10, 15, 20, 30 minutes of physical activity to do at least like 5 days a week, even at home. They can buy just like 1, 2 kilograms, depending on what they're starting with, and do some exercises at home. And then with time, we can escalate. Time management is very important. If you can plan your day ahead, let's say the day before or early in the day today, know what you're going to do in terms of work, visiting family, uh, exercise, even plan the time, what you're gonna eat, when you're gonna snack, what you're gonna snack on will make a big difference. I think structure is very important, and structure is something that I see in people who are successful in losing significant weight. So we talked about lifestyle. Now I'm going to shift gears gradually to discuss ways to help people. Before I do that, let me do this poll. In those who follow a lifestyle modification program, what is the proportion of people who are able to achieve 10% or more weight reduction? So let's say you have 100 people, and the 100 people weigh 100 kilograms. How many of them will lose more than 10 kilograms? Yeah. So here, 50% of the people believe that if I have 100 people, only 25 of them will achieve 10% weight reduction. And this is actually the truth. So the reality is, when we look at studies investigating intensive lifestyle or intensive behavioral modification, which requires a lot of resources and efforts to do, the average weight loss achieved is 5 to 10%. If you want to look at people who achieve more than 10% weight loss, only 25% or less achieve this amount of weight loss of all people. And unfortunately, this proportion is even lower in people who really need to lose that much weight. It's lower in patients with diabetes, lower in patients with other conditions. So the reality is in clinic, we focus on lifestyle modification, but many of the patients who are referred to me to clinic are people who have been trying lifestyle modifications for the last 10, 20 years, and were not able to achieve 10% weight loss and maintain it long term. So in those who have a medical condition like diabetes, obstructive sleep apnea, fatty liver, and they would benefit from losing 10% or more of their total body weight, and they were not able to lose significant weight with lifestyle modification, we offer them ways to help. And there are different ways. One of the things that I will discuss briefly is bariatric and metabolic surgery. It's the most effective weight management intervention, but it's the least utilized. When you compare bariatric or metabolic surgery to medications to manage type 2 diabetes, metabolic surgery is better by all parameters, but unfortunately, it's not being used as much in patients in general. So, patients who undergo bariatric or metabolic surgery, whether sleeve or bypass, achieve approximately 25% weight loss reduction. There is some weight regain after a few years, but then they maintain a significant amount of weight after 20 years. As I mentioned, many people are not interested in bariatric surgery. My role in clinic is to discuss the benefits and risk of all interventions and see what works with the individuals. Each one is different, and people preferences should be valued. Obesity management medications or anti-obesity medications are very, very popular nowadays. Many people are seeking them. Unfortunately, many of them are using them without medical supervision. And unfortunately, they're being overused and overutilized. There are several medications. The newer generations one are the ones that are being used more commonly. And the reason so is because they're the only interventions that can help you achieve more than 10% average weight reduction. Semaglutide, which is also known as Ozempic or Wegovy, is associated with 15% average weight reduction. Tirzepatide, also known as Mounjaro, is associated with 21% average weight reduction, which is something we were not seeing with lifestyle modification alone. So they're definitely more potent than lifestyle modification alone. But what's important to keep in mind is that when we're using them, we really want to use them as an adjunct to healthy lifestyle. We want to use them to help people get on the right track. We do not want to use them as an alternative to healthy lifestyle modification. The obesity management medications are proven to have several health benefits. They're effective for weight reductions, and I explained to you the degree of weight reduction that's experienced by these medications. The newer generation are associated with 2% reduction in hemoglobin A1C, which is more potent than the older generation medications we had. So they're really good at controlling diabetes. And we don't need to go really high with doses to get this benefit. We have strong studies, randomized controlled trials showing that the use of these medications reduces cardiovascular complications in those who are at risk of developing cardiovascular conditions. We have a strong study with semaglutide or Ozempic showing that the use of this medication in patients with proteinuria, kidney disease, will protect the kidney and will slow down the progression of kidney disease. We have studies with tirzepatide or Mounjaro showing significant improvement in obstructive sleep apnea, a significant reduction in the apnea-hypopnea index. And we have a study showing significant improvement in osteoarthritis. Nothing comes without risks. Everything is associated with risks. The most common side effect adverse events that we see with these medications are gastrointestinal side effects: nausea, vomiting, abdominal pain, lightheadedness, headache, mood swings. So this is what we see most of the time in clinic. A common misconception is that I will take the weight loss medication for 3, 6 months and then I'll stop it. It does not work for most people. So when people take it, they lose weight, but when they stop it, they experience rapid weight gain. This is the case with the majority of people. Most people will need to take the medication long term to maintain the weight. There are a few exceptions, but most people will need to stay on the medication. Many people ask me about natural products for weight reduction. A common thing that comes up is apple cider vinegar. There is a randomized controlled trial from Lebanon that randomized people to apple cider vinegar, different amount compared to placebo. And they found that the groups that received apple cider vinegar achieved 5 to 10% weight reduction from week 0 to week 12. We don't know the long-term outcomes, but it seems like compared to placebo, apple cider vinegar helped. The way they used it in the study with group 1, they diluted 15 ml in a glass of water. It's very important to dilute it to prevent teeth erosions. And it seems this is the results that they had. I don't mind people using apple cider vinegar. But what I'm against, I'm not a fan of using processed supplements. People who are getting me supplements that they bought online, cactus pills for weight reduction. And the reason I'm not a fan and I do not recommend it, because for these supplements to be produced, they go through processing. For you to see the supplement in a tablet format, they go through processing. The processing is not as regulated as the processing for medications. So I'm really not comfortable with the safety of these supplements because they're not well regulated. And I'm not comfortable with their efficacy. So I'm being asked about supplements that I don't know if they're going to help. And I'm not sure if they're safe. So most of the time, I would say no to supplements. If you want to take stuff from their natural sources, go ahead and do most of the time. But I'm not a fan of supplements in a tablet format. Okay. Last slide on diabetes management in Ramadan. Observing the month of Ramadan is associated with spiritual and psychological well-being. Many people who have diabetes wish to fast to get this spiritual and psychological well-being. But it's very important to keep in mind that people with diabetes are a heterogeneous group of people. They're not all the same. Ramadan fasting might be doable for many, but for many, it can be associated with complications such as low glucose or high glucose. It's very important to see your doctor before you decide to fast. Your doctor will use a risk calculator, which I will check with you, which I will share with you. This risk calculator will risk classify the individual into low risk of complication, moderate risk of complication, high risk of complications. And those who are high risk of complications should not fast for their own benefit. It's very important to meet with your doctor before fasting, or now if you have not done so, to receive education on how to manage your diabetes during Ramadan. Many patients will need medication adjustment to avoid complications. They will need to monitor their sugar closely during Ramadan, and they need to be instructed, okay, I started fasting, things are not heading in the right direction. I need to know what are the red flags and when I should break my fast. Here's a QR code for the risk calculator. And I'd like to thank everyone for listening, and I'm happy to take questions.
Great. Thank you very much, Dr. Tariq, for the wonderful session. So really, really helpful. So hopefully, it'll help people to, separate myth from fact. We have questions coming in. I think maybe you can clarify, of course, there are lots of questions on lifestyle and how effective is it, and of course now we've got these medications which show that there is of course increased percentage of weight reduction, which is what people are ultimately interested in. So can you just elaborate a little bit on our lifestyle change is not effective? Can we clarify that?
So, on average, lifestyle modification is associated with 5 to 10% weight reduction. So, someone who weighs 100 will lose 5 to 10 kilograms. But that's not
Right.
the case for everyone. We know, like people in the public know, and people in clinic know, that there's a proportion of people who will be able to achieve significant weight reduction with lifestyle modification alone. And this is
Yes.
preferred. So, if it's possible, I
Yeah.
encourage people to try if they're able to achieve that with lifestyle modification alone, it's definitely preferred over using medications.
Right.
But let's say someone tried and they were not able to, and
Mm.
let's say they have a condition that would benefit from significant weight reduction. I strongly recommend the use of these medications because they will be associated with significant weight reduction and significant improvement in the obesity-related medical condition. I
Right.
mentioned this earlier. The
Yeah.
medications are not an alternative to healthy lifestyle. We really hope that people who use them as an adjunct to healthy lifestyle.
So, Dr. Tariq, you had also shown that one study that, okay, if people take it for 6 months and then decide to go off the medication, but then the weight comes back on very quickly. So how do people manage that then? I mean, some people are also saying if we are treating obesity as a disease and these are anti-obesity drugs, so as for diabetes, you could be on anti-diabetic medication for life. Can we potentially stay on these medication for life then?
Yes. So there are several issues. The first issue, the definition of obesity, the clinical diagnosis of obesity. So the way we're relying on now with the classes,
Mhm.
50% of the individuals have the disease,
Right,
which is not possible.
right,
There was a Lancet Commission. They tried to redefine obesity, so they're working on this. It's published. So not it does not make sense that 50% of the people are eligible to receive medical treatment for a
right.
disease. We do not want to medicate everyone in this. Um, but this is the reality. So when we're using medications to lose weight, most people will need to stay on the medications. I've had some exceptions where they took the medications for 6, 12 months.
Okay.
After that, after that, they were able to maintain it without the medications.
Okay.
The thing that they share in common, they're younger and they do a significant amount of exercise. A
Mm,
significant amount of exercise.
yeah.
Not just
And
like
I
for an hour, no, a
yeah.
significant amount of cardio and resistance
Significant,
training.
right. And I think that's very important. And also to that point, Dr. Tariq, where you mentioned that structure is really important, right?
Mhm.
I mean, I've seen people, who are very regimental in kind of the lifestyles that they lead. You will see that, I've seen people whose weight hasn't fluctuated at all because they're very regimental in what they're eating. They have structure to their life, everything like sleep pattern. Of course, we have stresses and all of that, but most of the time, like where they can, their life is very structured in what they're doing. Okay, so let's maybe answer some of the questions related to the drugs that we have for anti-obesity. So where Rana is asking, can we use Wegovy Manjaro without first trying glucophage?
Tamam.
uh,
Good.
she sees a lot of people like skipping this phase.
Yeah. Um, you can. So metformin or glucophage is not FDA approved for weight management, but
Mhm.
it's used off-label. It is in the Qatar National Guidelines for Obesity Management. The advantage of metformin and glucophage is that it's completely safe and it's
Right,
cheap and it's oral. Okay.
right,
But in terms of efficacy, you cannot compare the efficacy of metformin to the newer injections.
right,
Um, so what I usually do, I discuss with patients the two options and see what they prefer to start with.
right.
Um, there is some evidence that using both, so let's say someone who has diabetes on
Mhm.
metformin, and I
Right.
add Monjaro and I compare it to
Yes.
someone who has diabetes who is not on metformin and I add Monjaro, the people
Yes.
who take metformin and Monjaro combination have better outcomes than the people who take Monjaro alone.
Sure. Okay. And I think that makes sense also. So thank you for that. So another question, I think this is an important question. So The question is, people who are fit, healthy, and trying to, engage in healthy lifestyles, why do they still acquire diabetes? I mean, we may think we see sometimes, individuals who are not overweight, but again, they do, develop diabetes. So what is happening there?
Yeah. So if we're talking about type 2 diabetes and people who are
Yes.
lean,
Yeah.
so again, we mentioned that obesity is the main driver, but it's not the only driver. So
Sure.
there are people with type 2 diabetes who are lean, but they have reasons why they have insulin resistance, genetic predisposition, polycystic ovarian syndrome. So some people do not have significant overweight or obesity, but they have
Right.
reasons to have insulin resistance, which contribute to their type 2 diabetes.
Mhm. Okay, great. So another question, about Ramadan specifically, in people with insulin resistance during Ramadan who have only one meal per day, like iftar, does the size of the meal matter in stimulating the insulin peak?
Yes. I think the more you eat, the more carb you eat, the more insulin you will release. What's
Mhm.
important to talk about is food order. The sequence of what you
Yeah,
eat is very important for this.
very.
So if you're eating the same meal, but you start with salad, protein, and you end with carb, your insulin spike will be lower than if you started with sugar, carbs, and then you ended with salad and carbs. So the food order is very important, and it can be used as an easy tool to prevent the rapid spike in sugar.
Mhm. Sure, great. And just talking a little bit about that, what are your thoughts about, you've got glucose sensors now available and people are using those, to watch, maybe the glucose peak. Is that a good way, even for people who are not diabetic? Is that a good way for people to monitor maybe, what is spiking the glucose levels or not? What are your thoughts about sensor? How good is the data?
So for the use in people with diabetes, it's great because it makes their life easier. It gives them information about what they're doing right and what they're doing wrong. So it helps with behavior modification. In
Great.
people without diabetes, I'm not sure about the utility. I wore one during training to learn what patients go through, and I tried to
Yeah,
shock my body with things that I
right.
eat. It's really impressive how well how well your body works when things are normal. So
Hmm.
your body has no, a normal body has the ability to maintain a normal glucose regardless of what you eat. So I tried to shock my body, and my body was
Right.
able to maintain the glucose between 80 and 140. I was not able to go above 140 regardless of what I eat. So I think in
Right.
people who have normal metabolic function, I don't think the sensor will provide significant information.
Okay.
But in people
Okay.
who have pre-diabetes or diabetes, it will provide some
Sure.
information.
Okay, great. So another question, on people on Ozempic, because they lose a lot of fat and, become very skinny. What are your thoughts about that? How do people manage that?
Yeah. So I'm assuming we're talking about the cosmetic changes that happens. Yes,
Yes.
that was a big phase. Yeah, so it does happen with any weight reduction, whether with lifestyle, medication, or surgery. It's risk and benefit. If you have diabetes and you lost significant weight,
Mhm.
uh, y- you likely have better outcomes. I understand the psychosocial impact of facial
Yeah.
changes, but you can always see a plastic and cosmetic doctor who would be able to provide options to troubleshoot this issue.
So, Dr. Tariq, since you are in practice, are you seeing a lot of stigma attached to these anti-obesity drugs where people are taking them, losing a lot of weight? How is society, taking that?
Yeah. So
Do
my
you hear
practice, my
patients?
practice changed before 2020 and after 2020. So
Okay,
around 2020, Ozempic was approved and it was on social
right.
media and everyone
Okay.
knew about it. So before 2020, I was convincing people in my clinic to take the injections.
Hmm.
Now I'm convincing people not to take the injections because everyone
Right.
would have taken the injections.
Yes.
So I really think that they're amazing drugs. They should be used, but they should be used in the right setting and in the right people. It
Mhm.
does not make sense for 50% of the population to take a medication for weight management. I think we
Right.
should put more effort on lifestyle modification, more effort on obesity prevention. I know obesity treatment is tough. It's
Yes.
difficult. It's not easy.
Yes.
So I get it why people want to take a medication to lose weight, but I think this should not distract us from focusing on obesity prevention and preventing the problem from its roots.
So, Dr. Tariq, again, like on social media, also you see a lot of people who struggle with losing weight. So, one of the things that they say that they have been struggling with, they just think about food all the time. So it changes, whatever way that their brain thinks about food, but they are all the time. And these anti-obesity drugs actually help them, you know.
Yes.
So they just feel that it has changed their life. Is that really the case where people actually are going through that? Because I'm hearing that a lot on social media, that it's been a game changer, for a lot of people who are actually suffering.
Yes, yes. So this is the part that I mentioned that we don't really understand. There are some people who have high cravings, high
Right.
appetite, they're hyperphagic all the time.
Yes. Yeah.
Some of them undergo surgery and they're still not able to control themselves and they gain the weight. And then they take the medication and
Mm.
it controls the signal. It goes to the
Yeah.
hypothalamus and it tells your brain, I'm
Sure.
good. I don't need to eat. So it does slow down the signals that
Right.
make people crave, feel hungry. Yeah.
Okay, great. So, just another thing, of course, you showed a graph which showed that bariatric surgery is effective. But again, with any kind of surgery, it does, come with a reduction of quality of life after the surgery. These medications for now, if you take them, you may have to be on them for life.
Yeah.
Uh, what again is the most natural solution?
To, to lose more than 10% total body weight, I don't think there is a natural solution. Prevention, I would say, is the most
Yes.
natural solution. But I think once the problem is developed and you need to lose significant weight, for the majority of people, you will need help. So they looked at quality of life with medications and surgery. They both improve quality of life in the general study population. But in
Okay.
practice, you'll always have some people who do not feel
Yes.
well, either on the medication or surgery. With medication, there's a step backward. Stop the medication, you go back to your baseline. With surgery, there is no step backward.
Right, right. Okay, so just sort of maybe just coming down to the last couple of questions. I know we're beyond the 2 p.m., but what is the best educational advice to give for young children to prevent the disease? I mean, again, like you said, not to focus on children talking about their weight all the time. How do we sort of engage with young children, to sort of engage in healthy behaviors? I think that's a dilemma which we are facing all over the world.
Yeah. I think what's really important is structuring the lifestyle, keeping them busy. Always have it. Okay, this is the time for swimming. This is the time for karate. This is the time. So keep them busy.
Yeah.
Uh, Limit screen time. So let's say they're playing video games, they're watching TV, and they're eating. Structure is very important.
Right.
Uh, and then just like a balanced diet. So eating healthy meals, but it's okay to every now and then have a treat. I'm
Mhm.
against having the treat at home because like if you have a treat at home all the time, it's easy access. But let's say they want a treat, go with them, buy something, eat it, and then go back. Do not store significant amount of treats at home because once you have significant amount of treats, access will be easy and consumption will be uncontrollable for both parents and kids.
Yes, absolutely. Just another question, which I think is important to answer. So, for those people who are diabetic and they are taking medication for diabetes, and one day they maintain a normal blood sugar, do they still need to take the medication to keep their blood sugar normal?
Uh, the other medications, so let's say, is that what you're?
I think they're talking about the diabetic
Yeah.
medication.
Well,
If
in
the blood
general,
sugar,
yes, yes, yes. So in general, so yes, let's say you have someone with diabetes, you start the medication to treat diabetes, their sugar
yes,
is normal. They need to stay on the
yes,
medication to
right,
maintain
right,
glucose.
right,
Yeah.
absolutely.
Same thing, blood pressure. You have hypertension, you
Right.
take a medication, you
Yes,
stop it,
but
blood pressure will be
yeah. That's not good. So yes, if you are diabetic and you're on medication, even if your blood sugar is normal, But again, you should refer to your healthcare practitioner, please. We are not here to give individual advice, but we are just talking generally. Just maybe one last not email, sorry. One last question. So again, talking a little bit about popular weight loss diets. I mean, I know you alluded to some, the keto diet and low carb diet and all of that. What are your thoughts about that? And also, I'm going to just ask because a lot of people are now using tracking apps to track their macros, the macronutrients they're taking. And also just combined with this, every um, exercise person, every influencer on social media is promoting high intake of protein nowadays. Every
Mhm.
second video that you see, so they are recommending, higher intake of protein. What are your thoughts about that?
Yeah, so I think counting is tough for most people. So people will be
Mhm.
able to count for a week too, but then it's
Yes.
overwhelming. It's very hard
How do you
to count.
sustain it for the whole life?
One thing that will probably play a significant role in the future is artificial intelligence,
Hmm.
ChatGPT, and other platforms that you can use to give you options and guide you on how to follow a
Okay.
certain dietary pattern. Um, Studies don't show one dietary pattern over the other. So it
Mhm.
depends where you're from. So I think where you're from, what you like, what
Right.
medical conditions you have are the ones that should play a role in what dietary pattern to follow. Um, so I agree with adequate protein intake, but I disagree with excessive amount of protein.
Mhm. Right.
uh, Bodybuilders like use excessive amount of protein. I did
Mhm.
it a few years ago and I got gout because of it. So, I think everything in moderation
Everything
is
in
fine.
moderation.
Yeah.
Yes, absolutely. I think wonderful session. Thank you so much for answering all the questions. I think a very insightful session. I certainly learned a lot also. Thank you, Dr. Tariq, and we would like to thank all our audience today for coming in and joining us. So we're grateful to everybody for the session. Inshallah, we'll see everybody at the next session. So really, really grateful to you, Dr. Tariq. Thank you so much.
Thank you so much for having me, and Ramadan Kareem to everyone.
Absolutely. Bye-bye for now.